Hello, my name is Aleesha. I'm going to be doing my head to toe assessment on my patient. She chose to wear loose clothing as opposed to a gown. She's already emptied her bladder. Her vital signs were tested. They were within normal limits. I also tested her height and weight and BMI. Her distant vision was tested using a Snellen chart, and her near vision was tested using a Rosenbaum chart, and it was within normal limits and no glasses. Her gait was steady, and now I'm going to go into my assessment. Her skin is warm and dry. It's appropriate for her ethnicity. Her head is normal cephalic. Her facial bones are symmetric, and no abnormalities, no nodules. And now I'm going to test her frontal sinuses, maxillary sinuses, lateral apparatus, and there is no pain and tenderness noted. And I'm going to test cranial nerve 5 for a facial sensation. And you tell me if you feel sharp or dull.
Dull, dull, sharp, 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 dull.
Okay, and I'm going to go ahead and test her facial cranial nerve. And if you can puff out your lips and smile, clench your teeth, flick out your tongue, and wrinkle your forehead. And her cranial nerves are intact. And I'm going to go ahead and test her, look at her conjunctiva, which is pink and moist and intact, and her sclera is white. And now I will test the 6 cardinal field gaze and her, I'm going to go back and test her temporal mandibular. You can open your mouth, and there was no clicking, popping, or crevices. Then I'll test the 6 cardinal field gaze, and you just follow my pen light. Okay. And now I'm going to test her eyes. So you can just look straight ahead, direct, consensual, correct, consensual. Her pupils are equal, round, reactive to light and accommodation. Her eyebrows are symmetric, and her hair is evenly distributed. Her eyelashes are pointing outward. And now if you can cover your eye and look forward for me. Okay. And cover your other eye and look forward. And there is no nystagmus and no extraocular movements. And now I'm going to go ahead and look at your ears. The tops of her ears are symmetric with her eyes. Look at her external canals. There's no sternum or drainage noted. As I palpate her ears, there's no nodules. There's no pain or tenderness. And now I'm going to look in your ears or your tympanic membrane. And as I look at her tympanic membrane, it is pearly gray, no sternum or drainage or fluid noted. Look at them on both sides. Her tympanic membrane is pearly gray, no drainage or sternum noted. And now I'm going to do a hearing test. And you cover up one of your ears. And when I say some words, then you just repeat what I said. 1, 2, 3. And up your other ear. 4, 5, 6. Okay. And her cranial nerve 8 is intact. And now I'm going to do the Weber test. And as I strike the fork, she should hear the vibrations in both her ears bilaterally. So let me know if you hear it. Okay, and it was heard in both ears bilaterally. And now I'll do the Renee test. And as I strike the fork, I'll put it on your mesoid process. And you tell me when you stop hearing the vibration. And I put it in front of her external ear canal. Tell me when you stop hearing the vibration. And then I'll do it to the other side. Okay. And her air conduction is twice as long as her bone conduction. And now I'll go to her nose. Her nose is midline, no nodules present, no abnormalities. As I look at her nose, her mucosa is pink, moist, intact. The hair is evenly distributed. The septum is midline. And if you could push down one of your nostrils for me and breathe normally. And then do the other side. Okay. So her nostrils are patent. And then as I look at her lips, they are pink and moist. And then, sorry, go back to her nose, and the turbinates are also intact and normal, no bleeding, no inflammation. And as I go to her lips, they are pink and moist and intact. And look inside of your mouth, her buccal mucosa, her hard and soft palate, and lift up your tongue. The floor of her mouth are all pink, moist, and intact. And now I will look at the anterior posterior pillars, the uvula, the tonsils, and the posterior pharynx. And they are all pink, moist, and intact. And you say cheese. Her gums are free inflammation. She has 32 pearly white teeth. And as I look at her tongue, it is pink and moist. And if you look out your tongue, move from side to side. Her tongue freely moves. And now we open up your mouth. Her uvula and her soft palate rise, and you can say ah, ah. And she has her gag reflex is present. And now you can move your tongue, push your tongue against my fingers. And her tongue has great resistance. And now I will go to her neck. Her trachea is midline. No jugular venous distension noted. Her thyroid is not visible and not enlarged. And then if you can swallow for me. Her thyroid moves up and down when she swallows. And let's feel for her carotids. They are present in 2+. And then her periocular lymph nodes, and her posterior ocular lymph nodes, and her occipital lymph nodes, her tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular, intraclavicular, and axillary lymph nodes are all present, no pain, tenderness, and non-palpable. And now test her range of motion. You can move your head from side to side, front and back, and her range of motion is intact and normal. And you can shrug your shoulders for me. She has good muscle tone and muscle strength. And if you could push her head against my hand, push your head against my hand. Good tone and muscle strength. And now I will listen to her carotids and her thyroid. Like, let's go get my stethoscope real quick. Okay, and as I listen to her carotid, no breweries heard, they are strong. Listen to her thyroid, no breweries heard, and they are strong. And now I'll go to her arms. Again, her arms are warm and dry, appropriate for ethnicity. They are equal and the same length. Her fingernails, no splitting noted, no clubbing, no edema. Her capillary refill is less than 3 seconds. Her brachial pulses are 2+. her radial pulses are 2 plus. And then if you could push your hands against mine and pull. And then her range of motion is appropriate and intact and good muscle tone and muscle strength. And now I'll have you turn around to your back. And as I look at her skin, her AP diameter is 2-to-1 ratio. Her skin is uniform, no use of axillary muscles, and has normal rate and rhythm. And as I go down to test tactile firmness, say 99. Mm-hmm. Mm-hmm. And laterally, vibrations felt through all lung fields. And now I will test for the chest extension. Just take a deep breath. And my thumbs go in and out on symmetrical extension. And now I will test for the coastal vertebral angle. No pain or tenderness noted. And now I will percuss throughout her lung fields. And I will. And resonance is heard throughout her lung fields. And now we'll do the diaphragmatic excursion. You can take a deep breath and hold it. And I will mark here. And we can take a deep breath and hold it on when you exhale. And I will mark here where resonance is heard, and it should be about 3 to 5 centimeters in space. And now I will also take her lungs. And as the stethoscope hits your back, if you just take a deep breath. And laterally. And she has normal rate and rhythm, no crackles or wheezing heard. And if you can turn around. And as I inspect her chest, her skin is uniform, no use of accessory muscles, no pulsations. And I'll do the tactile firmness. Just say 99. And vibrations felt throughout her lung fields. And now I will percuss her lung fields. And laterally. Resonance is heard throughout her lung fields. And I will palpate. No pulsations felt, no thrills or heaves felt throughout her lung cavity. Now I'll also take her lungs, and her apical pulse is present. Just breathe normally. No wheezing or crackles heard, and her respirations are normal in rate and rhythm. And now let's just listen for her heart sound. Aortic, component, Earth's point, tricuspid, and mitral, and no murmurs in S1 and S2 are heard throughout her lung fields. And now, if you go lay down or back, and I will lift up your shirt. Her umbilicus is midline. Her stomach contour is flat. No pulses noted. And now I will also take her abdomen, and I should hear vital sounds in all four quadrants within 5 seconds. Vital sounds were heard in all four quadrants, and now I will listen to the abdominal arteries, the aortic, renal, iliac, femoral, and arteries are normal. And now I will cuss. And Tiffany is heard throughout the abdominal cavity, and dullness are heard along the organs. And now I will percuss the liver edge. And the dullness is heard throughout the liver edge. And if you could turn towards me, and I'll percuss the splenic. And dullness is heard along the spleen. You can lay back on your back. And now we'll do light palpitation, checking for pain, tenderness, guarding. And now we'll do deep palpitation, again checking for pain, tenderness, and guarding. And now we'll palpate for the right costal margin of the liver. Okay, and it is felt. No nodules present or masses. And I will check for the left costal margin of the spleen. And it does not felt, and it is normal if it is not felt. And then I will check the aortic pulse. And it is within normal limits. And I will check for the accessory muscles and have you sit up. And your accessory muscles are strong within normal limits and intact. And move your legs over to the side. And then as I look at her skin on her legs, it is uniform, warm, no edema, and no coolness. Her toes and her nails are not cyanotic and no nail splitting. And now I will listen for feel your pulses and your popliteal pulse, her dorsal pedis, and your posterior tibial, and all of them are intact and 2+. And now I will listen for your reflexes and the brachial reflexes. Okay. And it's 2+, the popliteal reflexes, 2+, and the Achilles reflexes, sorry. And there are 2+. Again, that was the brachial reflex, the popliteal reflex, and the Achilles reflex. And they are all 2+. And her legs, again, her hair is evenly distributed throughout her legs. And now I'm going to check your range of motion. If you could pull your hands and then push my hands and then do your feet as well. And she has good muscle tone and muscle strength. And I will have her stand. And as she stands, I will check her range of motion. You move side to side and front to back. And she has appropriate range of motion. And if you could turn to the back. in her cervical cavity, her thoracic cavity, and lumbar cavity. It's aligned, it has normal curvature, and if you can bend forward. Her vertebral has no scoliosis and no kyphosis noted. Okay. And if you can move side to side, and again, her range of motion is intact. Okay. And this does conclude my assessment. Now in the assessment, I did not test for cranial nerve 1, which is the olfactory cranial nerve. We did not have the equipment, but it will be used to test her smell. I tested cranial nerve 2, which is the optic cranial nerve, the Stelling chart and the Rosenbaum chart. Cranial nerves 3, 4, and 6, which is the ocular motor, the trochlear, and the abducens, were tested using the 6 cardinal fields of gaze. Cranial nerve 5, which is the trigeminal cranial nerve, was tested with the facial sensation. Cranial nerve 7, the facial cranial nerve, was tested with the facial movements. Cranial nerve 8, which is the acoustic cranial nerve, was tested with the whisper test. Cranial nerves 9 and 10, the glossopharyngeal and the vagus cranial nerve, were tested with the the gag, and the swallow reflex. And cranial nerve 11, the spinal accessory cranial nerve, was tested with the shrug of her shoulders. And cranial nerve 12, the hypoglossal cranial nerve, was tested with her tongue movements. And this does conclude my assessment. Thank you.